In the sterile corridors of military hospitals, where rank and protocol rule every interaction, sometimes the most powerful weapon isn't a gun or a grenade. It's a single word whispered at the right moment. What happened in Ward 7 that cold February morning would challenge everything the medical staff thought they knew about duty, compassion, and the invisible bonds that tie soldiers together. When Sergeant Marcus Thompson lay dying, refused treatment by his own commanding officer, one nurse's desperate gamble with a secret only brothers in arms would know became the difference between life and death. This is the story of how a password meant for battlefields saved a life in a place where healing should have been guaranteed. The ambulance sirens wailed through the pre-dawn darkness as they pulled into the emergency bay of Fort Bragg Medical Center. Inside the vehicle, Sergeant Marcus Thompson's life hung by a thread, his uniform soaked in blood from the training accident that had gone horribly wrong. The drill sergeant had been demonstrating proper rappelling techniques to new recruits when the safety harness failed, sending him plummeting 30 feet onto jagged rocks below. Nurse Sarah Martinez had been working the night shift for 3 years, but she had never seen anything quite like the broken man they wheeled through those doors. Marcus was conscious, but barely coherent, his left leg twisted at an unnatural angle, ribs clearly fractured, and a head wound that painted his face crimson. The medics rattled off his vitals as they transferred him to the gurney, and Sarah's heart sank. Internal bleeding, possible spinal injury, and worst of all, his blood pressure was dropping fast. Dr. Harrison Webb, the attending physician, took one look at the patient and immediately began barking orders. They needed to get Marcus into surgery within the hour, or they would lose him. Sarah had worked with Dr. Webb long enough to know that tone in his voice meant this was serious, life or death serious. She quickly began preparing the pre-operative medications while the trauma team assembled. But then Colonel Richard Hayes walked into the emergency room, and everything changed. The colonel was Marcus's commanding officer, a stern man with steel-gray hair and eyes that seemed to cut through people like ice. Sarah had heard stories about Hayes from other nurses, whispered conversations about his reputation for being ruthlessly by the book and showing little patience for what he considered weakness or failure. Colonel Hayes approached Dr. Webb with measured steps, his polished boots clicking against the linoleum floor. Sarah tried to focus on her work, but she could not help overhearing their conversation. The colonel's voice was low but firm as he spoke to the doctor about Marcus's condition and the circumstances of the accident. What Sarah heard next made her blood run cold. Colonel Hayes was questioning whether Marcus deserved immediate medical attention. According to the colonel, Marcus had been drinking the night before the training exercise, violating strict military protocol. There were also questions about whether the accident was truly accidental or the result of Marcus's own negligence and poor judgment. Dr. Webb's face flushed with anger as he listened to the colonel's implications. Sarah had never seen the usually calm physician look so furious. The doctor tried to explain that regardless of any disciplinary issues, Marcus was a human being in critical condition who needed immediate medical care. But Colonel Hayes was unmoved, citing military regulations and the need to investigate the incident thoroughly before authorizing expensive emergency surgery. The argument between the two men grew more heated by the minute. Other staff members in the emergency room began to notice the commotion, stealing glances at the colonel and the doctor as they faced off beside Marcus's gurney. Sarah felt sick to her stomach as she watched Marcus's condition deteriorate while the two men argued about protocol and procedures. Marcus himself drifted in and out of consciousness, occasionally mumbling words that Sarah could not quite make out. His skin was growing paler by the minute, and his breathing had become shallow and labored. The monitors around his bed continued to beep ominously, showing vital signs that were steadily declining. Sarah had joined the military nursing corps because she wanted to serve her country and help fellow soldiers. She had seen her share of injuries and trauma, but she had never encountered a situation where politics and military hierarchy stood in the way of saving someone's life. The whole situation felt surreal and wrong in ways that made her question everything she thought she knew about the military medical system. Dr. Webb continued to argue passionately for Marcus's immediate treatment, explaining in medical terms that every minute of delay significantly reduced the sergeant's chances of survival. But Colonel Hayes remained steadfast in his position, insisting that proper procedures must be followed and that there were larger issues at stake beyond one soldier's medical emergency. As the minutes ticked by, Sarah found herself growing increasingly desperate. She had taken an oath to do no harm and to provide care to those who needed it, regardless of circumstances. Watching Marcus suffer while bureaucracy and military politics prevented him from receiving treatment went against every instinct she had as a healthcare professional. The other nurses and medical technicians in the emergency room were clearly uncomfortable with the situation, but none of them seemed willing to challenge a colonel's authority directly. The military chain of command was sacred, and questioning a superior officer's decisions could have serious consequences for their careers and their own military standing. Sarah tried to focus on the tasks she could perform within her authority, monitoring Marcus's vital signs, adjusting his 4 fluids, and keeping him as comfortable as possible while the debate raged on. But she knew that these measures were just buying time, and time was running out fast for the injured sergeant. The emergency room's overhead lights cast harsh shadows across Marcus's face as he struggled to stay conscious. Sarah noticed that his lips were moving slightly, as if he was trying to say something important. She leaned closer to listen, hoping to catch whatever message he might be trying to communicate. What she heard was fragments of what sounded like military jargon, unit designations, and what might have been names of fellow soldiers. Marcus seemed to be reliving moments from his military service, perhaps thinking about the men he had trained and led over the years. Sarah realized that even in his critical condition, Marcus's thoughts were with his unit and his responsibilities as a non-commissioned officer. The irony was not lost on Sarah that a man who had dedicated his career to serving his country and training the next generation of soldiers was now being denied the medical care he desperately needed because of military bureaucracy. She had heard Marcus's reputation around the base. He was known as a tough but fair drill sergeant who genuinely cared about his recruits and took pride in preparing them for the challenges they would face. Colonel Hayes and Dr. Webb's argument had reached an impasse, with neither man willing to back down from their position. The colonel remained convinced that proper procedures and investigations must take precedence, while the doctor insisted that immediate medical intervention was the only thing that mattered. Sarah realized that unless something changed quickly, Marcus was going to die while they argued about regulations and protocols. The situation in the emergency room had become increasingly tense, with other medical staff members clearly uncomfortable but uncertain about how to intervene. The military hierarchy system meant that challenging a colonel's authority was not something to be taken lightly, and everyone understood that their careers could be affected by taking the wrong stance in this conflict. As Sarah continued to monitor Marcus's deteriorating condition, she began to formulate a desperate plan. She had heard stories from other military nurses about situations where medical professionals had to make difficult choices between following orders and following their oath to provide care. She had never imagined that she would find herself in such a position, but the circumstances seemed to be forcing her hand. The clock on the emergency room wall showed that nearly an hour had passed since Marcus had arrived. Dr. Webb's earlier assessment that they had an hour to get him into surgery was proving to be optimistic, and Sarah could see that the sergeant's condition was becoming increasingly critical with each passing minute. Marcus's blood pressure continued to drop despite the 4 fluids and medications they were administering. His heart rate was becoming irregular, and the monitors were showing signs that his body was beginning to shut down from blood loss and trauma. Sarah knew that they were approaching the point of no return, where even emergency surgery might not be enough to save him. The emergency room had grown eerily quiet except for the steady beeping of Marcus's monitors and the low, tense voices of Colonel Hayes and Dr. Webb as their argument continued. Sarah noticed that other medical personnel were finding reasons to busy themselves in different areas of the room, clearly uncomfortable with witnessing the confrontation between the high-ranking officer and the civilian doctor. Dr. Webb's frustration was becoming more visible by the minute. His usually neat appearance was disheveled, his surgical scrubs wrinkled from the stress of the situation. He had been practicing military medicine for over 15 years and had never encountered a situation where a commanding officer had actively prevented him from providing emergency care to a critically injured soldier. Colonel Hayes, meanwhile, remained composed and unwavering in his position. His military bearing was perfect, his uniform immaculate despite the early morning hour. To anyone watching, he appeared to be a model of military discipline and adherence to proper procedures. But Sarah could see something in his eyes that troubled her, a coldness that seemed to suggest that Marcus's life was less important than maintaining order and following regulations. The colonel had been explaining to Dr. Webb that Marcus's accident was under investigation by military police. There were questions about the sergeant's conduct in the hours leading up to the training exercise, including reports that he had been seen at the base club the previous evening. Colonel Hayes insisted that until the investigation was complete, authorizing expensive emergency surgery would be premature and potentially wasteful if Marcus was found to be at fault for his own injuries. Dr. Webb had tried repeatedly to explain that medical ethics and basic human decency demanded that they treat Marcus regardless of any potential disciplinary issues. The doctor argued passionately that saving a soldier's life took precedence over military investigations and that there would be plenty of time to address conduct issues after Marcus had recovered from his injuries. Sarah had been listening to this back and forth for what felt like hours, watching helplessly as Marcus's condition continued to deteriorate. His breathing had become even more labored, and she noticed that his skin was taking on a grayish pallor that she recognized as a sign of severe blood loss. The young sergeant was fighting for his life while two authority figures debated his fate based on regulations and procedures rather than medical necessity. The more Sarah observed Colonel Hayes, the more she began to suspect that there was something personal behind his reluctance to authorize Marcus's treatment. She had heard rumors around the base about tension between the colonel and some of his non-commissioned officers, particularly those who had earned the respect and loyalty of their troops. Marcus was known for his ability to connect with recruits and for his willingness to stand up for his soldiers when he felt they were being treated unfairly. Sarah remembered a conversation she had overheard in the base cafeteria several months earlier, where some soldiers were discussing how Marcus had challenged one of Colonel Hayes' decisions regarding punishment for a young recruit who had made a minor mistake during training. Marcus had argued that the punishment was too severe and that the recruit deserved a second chance rather than being immediately discharged from the military. The incident had apparently created ongoing tension between Marcus and Colonel Hayes, with the colonel viewing the sergeant's intervention as insubordination and Marcus believing he was simply looking out for his soldiers' welfare. Sarah began to wonder if the colonel's current stance was influenced more by personal animosity than by genuine concerns about military procedure. Dr. Webb had reached the point where he was considering going over Colonel Hayes' head to higher command, but Sarah knew that process could take hours or even days. Military bureaucracy was notoriously slow, and Marcus did not have the luxury of time. The sergeant needed immediate surgery if he was going to survive, and every minute of delay was reducing his chances of making it through the operation. As if sensing the gravity of the situation, Marcus began to stir more frequently, his eyes opening and closing as he struggled to maintain consciousness. Sarah moved closer to his gurney, checking his pupils and monitoring his responses to stimuli. What she saw confirmed her worst fears. Marcus was showing signs of severe neurological distress, likely from increased intracranial pressure due to his head injury. The monitors around Marcus's bed were painting an increasingly grim picture. His blood pressure had dropped to dangerously low levels, his heart rate was becoming erratic, and his oxygen saturation was declining despite the supplemental oxygen they were providing through a mask. Sarah realized that they were rapidly approaching the point where even emergency surgery might not be enough to save him. Colonel Hayes seemed oblivious to the medical urgency of the situation, continuing to lecture Dr. Webb about the importance of following proper military procedures and maintaining discipline within the ranks. The colonel spoke about the need to send a message to other soldiers that actions have consequences and that the military could not afford to overlook breaches of conduct, even when they resulted in serious injuries. Sarah found herself growing increasingly angry as she listened to the colonel's cold, calculated approach to Marcus's situation. She had joined the military nursing corps because she believed in serving her country and caring for those who put their lives on the line for freedom and democracy. Watching a soldier being denied medical care because of bureaucratic considerations went against everything she had sworn to uphold. The other medical staff in the emergency room were clearly struggling with the situation as well. Sarah could see the conflict in their faces as they tried to balance their professional obligations with their respect for military authority. Several nurses had approached Dr. Webb quietly to express their concerns, but none of them seemed willing to directly challenge Colonel Hayes' authority. Dr. Webb had begun making phone calls to try to reach higher-ranking officers who might be able to override Colonel Hayes' decision. But it was still early morning, and many of the senior command staff were not yet available. The doctor's frustration was evident as he left message after message, explaining the urgency of the situation and requesting immediate authorization for Marcus's surgery. Sarah watched the clock on the wall as precious minutes continued to tick away. She had seen enough trauma cases to know that Marcus was approaching the point of no return. His body was shutting down from blood loss and trauma, and his brain was swelling from the head injury. Without immediate surgical intervention, he would almost certainly die within the next hour. The young nurse found herself thinking about her own military oath and the promises she had made when she joined the nursing corps. She had sworn to provide care to all soldiers regardless of rank, circumstance, or personal considerations. She had promised to put the welfare of her patients above all other considerations, including her own career and personal safety. As she stood beside Marcus's gurney, watching his labored breathing and monitoring his failing vital signs, Sarah realized that she was facing a defining moment in her career and her life. She could continue to follow protocol and defer to Colonel Hayes' authority, knowing that Marcus would likely die as a result. Or she could take matters into her own hands and try to find a way to save his life, regardless of the potential consequences for her own military career. The decision was becoming clearer by the minute as Marcus's condition continued to deteriorate. Sarah had dedicated her life to healing and helping others, and she was not going to stand by and watch a fellow soldier die because of politics and personal animosity. She began to formulate a plan that was risky and potentially career-ending, but that might be Marcus's only chance for survival. Marcus's lips were moving again, and Sarah leaned closer to try to understand what he was saying. His voice was barely audible, a whisper that seemed to take tremendous effort to produce. She caught fragments of what sounded like unit designations and military terminology mixed with what might have been names of soldiers he had trained over the years. Sarah realized that even in his critical condition, Marcus was thinking about his responsibilities as a non-commissioned officer and his concern for the soldiers under his command. It struck her as profoundly unfair that a man who had devoted his career to serving others was now being denied the care he desperately needed because of military politics and bureaucratic considerations. Sarah's hands trembled slightly as she pretended to adjust Marcus's foreline while her mind raced through the desperate plan that was forming. She had overheard conversations among military personnel about special unit codes and passwords that soldiers used to identify themselves to each other in emergency situations. These codes were supposed to be used in combat scenarios, but Sarah wondered if they might work in a medical emergency as well. The idea was risky beyond measure. If she was wrong about the codes, or if Colonel Hayes realized what she was attempting, her military career would be over. She could face court-martial, discharge, and possibly even criminal charges for insubordination and interference with military authority. But As she looked at Marcus's deteriorating condition, she realized that her career concerns seemed insignificant compared to a human life hanging in the balance. Sarah had heard these unit codes mentioned in hushed conversations among soldiers who had served together in combat zones. They were secret passwords that identified members of special operations units to each other, codes that were supposed to transcend normal military hierarchy in life or death situations. The theory was that these codes would allow soldiers to help each other regardless of rank or command structure when survival was at stake. The problem was that Sarah was not entirely certain what Marcus's unit codes might be, or if Colonel Hayes would even recognize them if she used them correctly. She had picked up fragments of information from conversations she had overheard, but she was essentially gambling Marcus's life on incomplete knowledge and desperate hope. Dr. Webb's phone calls had been unsuccessful so far, with most senior officers either unavailable or unwilling to override Colonel Hayes' authority without a more thorough investigation of the circumstances. The doctor's frustration was evident as he continued to argue with the colonel about the medical necessity of immediate surgery, but it was clear that Hayes was not going to budge from his position. Marcus's vital signs continued to decline at an alarming rate. His blood pressure was now critically low, his heart rate was becoming increasingly irregular, and his breathing was so shallow that Sarah worried he might slip into respiratory arrest at any moment. The monitors around his bed were painting a picture of imminent system failure, and she knew that time had nearly run out. Colonel Hayes had begun to speak more dismissively about Marcus, referring to him as an example of what happened when soldiers failed to maintain proper discipline and standards. The colonel seemed to view Marcus's accident as a teaching moment for other soldiers, a demonstration of the consequences of poor judgment and conduct violations. Sarah found the colonel's attitude increasingly disturbing. She had witnessed enough military medicine to know that accidents happened even to the best soldiers, and that medical emergencies required compassion and immediate action rather than moral judgment and bureaucratic delays. The cold calculation in Hayes' approach to Marcus's situation suggested a man who had lost touch with the basic human values that should underlie military service. The emergency room had grown tense with the conflict between medical necessity and military authority. Other staff members were clearly uncomfortable with the situation, but the rigid military hierarchy made it difficult for anyone to challenge a colonel's decisions directly. Sarah realized that if anything was going to change, it would have to come from an unconventional approach that bypassed normal command structures. As she continued to monitor Marcus's condition, Sarah noticed that he seemed to be having moments of greater lucidity, brief periods where his eyes would open and he would try to speak. During one of these moments, she leaned closer and caught what sounded like unit designations and operational codes that she had heard mentioned by other soldiers. The fragments she could make out included references to what sounded like Special Forces units and operational call signs. Marcus seemed to be identifying himself using military terminology that suggested he had served in specialized roles beyond his current position as a drill sergeant. Sarah began to suspect that Marcus's military background was more complex and distinguished than his current assignment might suggest. This revelation gave Sarah hope that her desperate plan might actually work. If Marcus had indeed served in special operations units, he would have access to the kind of emergency codes that might transcend normal military hierarchy. The question was whether Colonel Hayes would recognize these codes and whether they would carry enough weight to override his current stance. Sarah also began to realize that Colonel Hayes might not be fully aware of Marcus's complete military background. The tension between the two men might stem from the colonel's failure to appreciate Marcus's qualifications and service record. If Marcus had served in elite units, his current position as a drill sergeant might not reflect the full extent of his military experience and achievements. Dr. Webb had reached the point of threatening to contact the base commander directly, despite the potential career consequences of going over Colonel Hayes' head. The doctor's medical training and ethical obligations were in direct conflict with military protocol, and he was clearly struggling with how to proceed. Sarah could see that the doctor was running out of options within the normal chain of command. The clock on the emergency room wall showed that more than 2 hours had passed since Marcus's arrival. Dr. Webb's original assessment that they had an hour to get him into surgery had proved overly optimistic, and Sarah knew that they were now in uncharted territory where even emergency surgery might not be sufficient to save Marcus's life. Marcus's condition had deteriorated to the point where he was drifting in and out of consciousness more frequently. His skin had taken on a waxy appearance that Sarah recognized as a sign of impending circulatory failure. The monitors showed that his body was beginning to shut down non-essential functions in an attempt to preserve vital organs. But even this natural defense mechanism would not be enough without immediate surgical intervention. Sarah made her decision. She approached Marcus's gurney and leaned close to his ear, speaking quietly so that her words would not be overheard by Colonel Hayes. She asked Marcus if he could remember any special unit codes or operational passwords that might help in an emergency situation. Her question was a long shot, but she was running out of options. Marcus's eyes opened slightly, and Sarah could see him trying to process her question through the fog of pain and medication. His lips moved weakly, and she had to strain to hear what he was trying to say. The words that came out were fragmented and difficult to understand, but Sarah caught what sounded like unit designations and alphanumeric codes. The codes Marcus whispered included references to special operations units and what appeared to be emergency authentication sequences. Sarah was not certain she understood them correctly, but she memorized what she could and prepared to take the biggest gamble of her military career. She was about to bet Marcus's life on her ability to use these codes to convince Colonel Hayes to authorize the surgery. As she straightened up from Marcus's bedside, Sarah caught the eye of Dr. Webb, who had been watching her interaction with the patient. The doctor seemed to sense that something significant had just occurred, and Sarah could see a mixture of curiosity and hope in his expression. Without saying anything directly, Sarah tried to communicate through her body language that she was about to attempt something that might change the situation. Colonel Hayes was still standing near the nurse's station, reviewing paperwork related to the incident investigation and making notes about the circumstances of Marcus's accident. The colonel appeared to be treating the entire situation as a routine administrative matter rather than a medical emergency involving a fellow soldier's life. Sarah took a deep breath and approached Colonel Hayes, knowing that the next few minutes would determine whether Marcus lived or died. She was about to use military codes that she only partially understood in an attempt to save a soldier's life, knowing that failure would mean not only Marcus's death, but also the end of her own military career. Sarah's heart pounded as she approached Colonel Hayes, knowing that what she was about to do could end her military career in disgrace or save Marcus's life. The colonel looked up from his paperwork with mild annoyance, clearly not expecting to be interrupted by a nurse while he was handling what he considered to be administrative matters related to the incident. Colonel Hayes had been in the military for over 25 years, rising through the ranks through strict adherence to regulations and unwavering discipline. His reputation for being by the book had earned him respect from superiors, but sometimes created tension with subordinates who felt he prioritized procedure over people. Sarah knew she was about to challenge his authority in a way that could have serious consequences for both of them. Sarah stood at attention and requested permission to speak privately with the colonel about Marcus's condition. Hayes looked surprised by the formal request from a nurse, but his military training dictated that he should at least hear what she had to say. He gestured for her to step aside where they could speak without being overheard by other medical staff. As they moved away from the main treatment area, Sarah noticed that Dr. Webb was watching them intently, clearly hoping that whatever Sarah was planning might break the deadlock that had prevented Marcus from receiving the surgery he desperately needed. The doctor's medical expertise told him that Marcus was running out of time, and his frustration with the bureaucratic obstacles was evident in his expression. Colonel Hayes faced Sarah with his typical military bearing, his posture straight, and his expression neutral but slightly impatient. He clearly expected this to be a brief conversation about routine medical procedures or administrative details related to Marcus's care. Sarah knew she had only one chance to present her information in a way that might convince him to reconsider his position. Sarah began by explaining that she had been monitoring Marcus's condition closely and that his vital signs indicated he was in immediate danger of dying without surgical intervention. She tried to emphasize the medical urgency while being respectful of the colonel's authority and concerns about proper procedure. Hayes listened politely, but showed no signs of changing his stance. Then, Sarah took the biggest risk of her career. She told Colonel Hayes that Marcus had regained consciousness briefly and had provided her with information that might be relevant to his case. She explained that the sergeant had given her what appeared to be special unit codes and operational passwords that suggested his military background was more complex than his current assignment indicated. Colonel Hayes's expression changed slightly when Sarah mentioned the codes. His professional demeanor remained intact, but she could see a flicker of interest or perhaps concern in his eyes. The colonel asked Sarah to repeat exactly what Marcus had told her, and she carefully recited the unit designations and alphanumeric sequences she had memorized. As Sarah spoke the codes, she watched Colonel Hayes's face carefully for any sign of recognition. The colonel's expression grew increasingly serious as he heard the specific combinations of letters and numbers that Marcus had provided. Sarah could tell that at least some of the codes were familiar to Hayes, though she was not certain what they meant or why they might be significant. Colonel Hayes was quiet for several long moments after Sarah finished reciting the codes. His military training had taught him to verify information carefully before acting on it, but the codes Sarah had provided were not the kind of information that would be widely known outside of certain specialized units. The specificity and accuracy of the code suggested that Marcus had indeed served in capacities that might not be reflected in his current personnel files. The codes Marcus had whispered were authentication sequences used by special operations units during classified missions overseas. These were not training codes or standard military identifiers, but rather emergency protocols designed to help soldiers identify themselves to friendly forces when normal communication channels were compromised. The fact that Marcus knew these codes indicated he had served in combat roles that required the highest levels of security clearance and operational expertise. Colonel Hayes began to realize that his assessment of Marcus might have been based on incomplete information about the sergeant's military background. The codes suggested that Marcus had served in elite units that operated under different rules and protocols than regular military forces. If Marcus was indeed a member of these special operations communities, there might be factors affecting his case that Hayes had not previously considered. Sarah watched as Colonel Hayes processed this information, hoping that the codes might provide the leverage needed to convince him to authorize Marcus's surgery. She could see that the colonel was weighing various considerations, including his responsibility to follow procedures against the possibility that Marcus's case involved circumstances beyond normal military protocols. The colonel asked Sarah several pointed questions about exactly when and how Marcus had provided these codes, clearly trying to verify the authenticity of the information. Sarah answered as honestly as possible, explaining that Marcus had been drifting in and out of consciousness, but had seemed lucid when he provided the codes in response to her question about emergency procedures. Colonel Hayes stepped away from Sarah and made a quiet phone call to what appeared to be a classified military number. Sarah could not hear the specifics of his conversation, but she could see that he was providing the codes Marcus had given her and requesting verification of their significance. The call lasted several minutes, during which time Sarah anxiously monitored Marcus's continuing deterioration from across the room. Dr. Webb approached Sarah while Colonel Hayes was on his phone call, asking what information she had provided to the colonel that seemed to have captured his attention. Sarah explained briefly about the military codes without going into specifics, and the doctor expressed hope that whatever Sarah had discovered might finally break through the bureaucratic obstacles that had been preventing Marcus from receiving treatment. Marcus's condition had become increasingly critical during the time Sarah spent talking with Colonel Hayes. His blood pressure had dropped to levels that indicated imminent cardiovascular collapse, and his breathing had become so shallow that the monitors were triggering low oxygen alarms. Dr. Webb explained to Sarah that they were approaching the point where even emergency surgery might not be sufficient to save Marcus's life. When Colonel Hayes finished his phone call, his demeanor had changed significantly. The rigid, bureaucratic approach he had maintained throughout the morning had been replaced by a more urgent and concerned expression. Sarah could tell that whatever information he had received during the call had altered his perspective on Marcus's situation and the authorization for his medical treatment. Colonel Hayes approached Dr. Webb directly and informed him that he was immediately authorizing all necessary medical procedures for Marcus's treatment. The colonel explained that he had received additional information about Marcus's service record that changed the circumstances of the case, though he did not provide specifics about what that information contained. Dr. Webb did not waste time asking for details about what had changed Colonel Hayes' mind. The doctor immediately began issuing orders to prepare Marcus for emergency surgery, knowing that every second of delay further reduced the sergeant's chances of survival. The medical team sprang into action with the efficiency of professionals who had been waiting for hours to do their jobs. Sarah felt a wave of relief wash over her as she watched the medical team prepare Marcus for surgery. Her desperate gamble with the military codes had apparently worked, though she was not entirely certain why or how. What mattered most was that Marcus was finally going to receive the medical care he needed, even though his condition had deteriorated significantly during the hours of bureaucratic delays. As the medical team wheeled Marcus toward the operating room, Sarah caught a glimpse of his face and thought she saw his eyes open briefly. For just a moment, it seemed as though Marcus was aware of what was happening around him and that he understood he was finally being taken to surgery. Sarah hoped that the codes he had provided would not only save his life, but also shed light on a military service record that was apparently more distinguished and complex than anyone had realized. The operating room doors swung shut behind Marcus as the surgical team began the race against time to save his life. Dr. Webb led the team with the focused intensity of a surgeon who understood that they were working with virtually no margin for error. The hours of delay had pushed Marcus's condition to the very edge of what medical science could address, but the team was determined to give him every possible chance for survival. Sarah remained in the emergency room, completing the paperwork and cleaning up the area where Marcus had been treated. As she worked, she found herself reflecting on the morning's events and wondering about the military codes that had apparently changed everything. She was curious about Marcus's background and what kind of service record would require such high-level authentication, but she knew that such information was likely classified and not something she would be allowed to access. Colonel Hayes had remained at the hospital after authorizing Marcus's surgery, which surprised Sarah given his earlier reluctance to even be involved in the case. The colonel seemed to be waiting for updates on the surgical procedure, and Sarah noticed that he had made several additional phone calls since speaking with her about the codes. Whatever information he had received about Marcus appeared to have significantly altered his perspective on the entire situation. About an hour after Marcus had been taken to surgery, Colonel Hayes approached Sarah and requested another private conversation. Sarah was nervous about what the colonel might want to discuss, wondering if he had questions about how she had obtained the military codes or concerns about her decision to approach him with the information. She followed him to a quiet area near the hospital waiting room. To Sarah's surprise, Colonel Hayes began by thanking her for bringing the codes to his attention and explaining that her actions had likely saved Marcus's life. The colonel revealed that the phone calls he had made led to the discovery of a classified service record that completely changed the circumstances surrounding Marcus's case. According to Hayes, Marcus had served in special operations units that operated under different protocols than regular military forces. Colonel Hayes explained that Marcus had been part of classified missions overseas that required the highest levels of security clearance and operational expertise. The codes he had provided to Sarah were authentication sequences used during these missions, codes that were known only to a select group of elite soldiers who had served in the most dangerous and sensitive military operations. The revelation about Marcus's background explained why he had been able to provide such specific and accurate military codes, even while critically injured and semi-conscious. It also explained why Colonel Hayes had been willing to reconsider his position after receiving verification of the code's authenticity. Marcus was not simply a drill sergeant who had violated protocol, but rather a decorated veteran whose service record commanded respect and immediate assistance. Colonel Hayes admitted to Sarah that his initial assessment of Marcus had been based on incomplete information about the sergeant's military background. The tension between Hayes and Marcus that had influenced the colonel's reluctance to authorize treatment stemmed from Hayes's lack of awareness about Marcus's true qualifications and service record. The colonel had viewed Marcus as an insubordinate non-commissioned officer without realizing that his background included elite military service that justified his confidence and leadership style. Sarah learned that Marcus's current assignment as a drill sergeant was actually a cover for ongoing classified activities that required him to maintain a lower profile. His real military specialty involved training and advising special operations units, work that required the kind of expertise and security clearance that explained his knowledge of the emergency codes. The incident with the recruit that had created tension with Colonel Hayes now made more sense in the context of Marcus's background in elite military training. The colonel explained that Marcus's apparent violation of protocol by drinking before the training exercise was actually part of a classified operation that required him to maintain certain appearances and behaviors. What Hayes had interpreted as poor judgment and conduct violations was actually Marcus following orders related to his covert assignments. The full details of these assignments were classified, but Hayes now understood that Marcus's actions had been authorized and necessary. As they spoke, Dr. Webb emerged from the operating room with news about Marcus's condition. The surgeon explained that the operation had been extremely challenging due to the delay in treatment, but that they had been able to address the most critical injuries. Marcus had suffered significant blood loss and trauma, but his vital signs had stabilized during surgery, and the medical team was cautiously optimistic about his chances for recovery. Dr. Webb emphasized that the hours of delay had made Marcus's case much more complicated and dangerous than it should have been. The surgeon explained that if they had been able to operate immediately upon Marcus's arrival, his prognosis would have been much better and his recovery much less uncertain. The bureaucratic obstacles had not only endangered Marcus's life, but had also made his medical treatment more difficult and less likely to be completely successful. Colonel Hayes accepted responsibility for the delays and acknowledged that his approach to the situation had been based on incomplete information and poor judgment. The colonel promised that there would be changes in protocols to ensure that medical emergencies received immediate attention regardless of any administrative or disciplinary concerns that might be involved. Hayes also indicated that there would be a thorough review of how classified service records were handled to prevent similar misunderstandings in the future. Sarah was relieved to hear that Marcus's surgery had been successful, but she was also troubled by the realization that his life had been unnecessarily endangered by military bureaucracy and incomplete information. The experience had taught her valuable lessons about the importance of advocating for patients and the need to look beyond surface appearances when making critical decisions about medical care. Over the following days, as Marcus slowly recovered from his injuries, more details emerged about his military background and the classified nature of his service. Sarah learned that Marcus had been involved in counterterrorism operations and had received numerous decorations for valor and distinguished service. His reputation among elite military units was exemplary, which explained why the emergency codes carried so much weight when Colonel Hayes verified them. The incident also led to changes in hospital protocols regarding the treatment of military personnel with classified backgrounds. New procedures were implemented to ensure that medical decisions would be based on patient needs rather than incomplete administrative information, and that emergency authentication codes would be recognized and verified quickly when they were provided by patients or their advocates. Marcus eventually made a full recovery from his injuries, though the process was longer and more difficult than it would have been if he had received immediate treatment. He was grateful to Sarah for her intervention and credited her quick thinking with saving his life. The experience strengthened his belief in the importance of looking out for fellow soldiers and the need for military personnel to support each other regardless of rank or assignment. Colonel Hayes developed a new appreciation for the complex nature of military service and the importance of understanding the full context before making decisions that affect soldiers' lives. His relationship with Marcus improved significantly once he understood the sergeant's true background and qualifications, and Hayes became an advocate for ensuring that classified service records were properly considered in personnel decisions. Sarah's actions during the crisis earned her recognition from both military and medical authorities. Her willingness to take risks to save a patient's life exemplified the best traditions of military nursing, and her story became an example of how individual courage and quick thinking could overcome bureaucratic obstacles. The experience reinforced her commitment to patient advocacy and her belief that medical care should never be compromised by administrative considerations. The case became a learning experience for the entire medical staff about the complex nature of military service and the importance of considering factors beyond surface appearances when dealing with military personnel. It highlighted the need for better communication between different levels of military command and the importance of ensuring that medical professionals had access to all relevant information when making treatment decisions. In the end, the incident that began as a training accident became a catalyst for important changes in military medical protocols and a reminder of the bonds that unite soldiers regardless of their official assignments or public roles. Marcus's recovery was not just a medical success story, but also a testament to the power of military brotherhood and the importance of standing up for fellow soldiers when their lives are at stake.